So we've done one video on back pain, but on the hip flexor. So today I want to talk about another common reason that I see back pain. So that would be the lat. So if you look right here, the lat is a really large muscle that covers the majority of the lower back, and then it runs and it attaches on the front side of the shoulder. So what you'll see with the lat is when you've been seated for a long period of time and maybe you have your arm out in front of you and the anterior shoulder is really short, the lat muscle will be placed under load. And so you'll kind of get this deep achy sensation. One way to tell that the pain's coming from the lat is you'll have limitation in rotating away from it. So maybe I can rotate to my left really far, but my right rotation is going to be really limited because that lat muscle is going to be restricted. So one thing that we do with that is if you've been seated at a desk for a long period of time, when you get up, try to elongate the lat. So if I put my arm overhead like this, I'm going to elongate that lat. So do it dynamically. So when you stand up, just put your arm overhead 5 or 6 times to try to loosen it. Now, if you need to get a little more in depth with it, you can put your hand on your seat like this, lean back, sit back on your heels, and then you're also going to put some stretch on that muscle right there. But it's a large muscle and you should have a pretty quick response with those two stretches, the dynamic one where you're swinging your arm and then the static one where you put your arm on the chair and stretch it out like that. That should help with it. If it's been around for 6 months or something like that, you're really dealing with a problem with it, so you want to get it checked out. Thanks.